Now, this video is not about bashing anyone, judging anyone, or deciding for you what you want to do with your body. It's your body, it's your choice. It's my body, it's my choice. But hello and welcome once again aboard JulieCity. How are you keeping? I hope you're keeping well and safe. As usual, I'm always excited to be here and I'm glad you are here. Thank you so much for clicking in to watch today's video. You're highly appreciated. Recently, there's been news, especially with the NAIJA, now we day here. Yeah, in the NAIJA media, there's been news and information about those ladies who decided to do some birth or enhancement and ended up in the land beyond. And I just thought to myself, it would be an opportunity to bring relevant information that will help you make up your mind. Peradventure, you are considering it. And like I said, it is not about judging you or determining for you what you want to do. So I'll just encourage you to sit, relax, and listen to the following information that I'm going to share here. I'm sure you might find one thing or two that you can take in order to make the right choice for you or share with somebody else that you come across that might be considering it. Now, there are so many reasons why people decide to enhance their butt or their buttocks or their yams. Some could be as a result of health reasons, yeah. Others could be just sheer aesthetics, just to look beautiful in their own concept of what beauty is all about, to look shapely. It could be that probably a person that is really overweight lost a lot of weight and there is need for them to kind of tighten up their skin around all the areas that they used to be really big. So, like I said, it's not for me to judge you, but for whatever reason it is that you have decided that butt enhancement is for you, then it's important to consider also the risk involved so that you will not end up like those stories that touch the heart. Of course, research shows, especially in America, where it is really common, that there's a lot of success story. However, there are lots of risk attached to it, and there has been loads of sad stories, particularly with the Nigerian environment, which is really where I'm targeting this video. The big thing is for you to make sure that whoever you choose to make this dream of yours come to pass, that person must be a person that is trained, qualified healthcare professional. Not just that, a qualified and specialized doctor in that area. It's not every doctor that does everything. No. There are people who are specialized in different areas of health. So you have some that are specialized in women's health. There are those who are specialized in the heart, those specialized in hearing and nose, those specialized in the way we breathe, and so on and so forth. So if you're going to choose to take such step, remember that your life is the most important thing. Please don't go under a Agege bridge. Please don't just take anybody, because you might be risking your life. As enticing and as appealing it might be, there are lots of risk attached to it, which I think you should consider before going ahead. Are there success stories? Yes, especially in America, where people engage specialized professionals. Yes, there are success stories, but even at that, there are also risks involved and there are also casualties. But the percentage of casualties that come across with this whole butt thing that seem to be going viral in Nigeria, it is really alarming, and that's why I thought I should bring this to light, especially with the fact that influencers, people that others look up to, especially through social media, are going into this and ending up with sad story. Then it's important that I share this information, knowing that JulieCity understands that your health is your wealth. So the first risk attached, not in any particular order, is the fact that with this surgery, you can have a buildup of fluid or blood, a buildup of blood underneath your skin, which is a hematoma. And this can also cause discoloration of the skin and cause other medical complications. Everybody responds differently, and everybody's immune system is different in the way they respond, depending on the environment and what people eat and how healthy they are. Wound healing might be poor. So you find that instead of a smooth sailing straightforward surgery where everything heals in a one straight line, you might end up with a poor healing process because of immune compromise or infection, and you end up with serious scars or even more complications. The scarring, yes, we know that with surgery comes a scar. Yes, because an incision is made on the skin, bringing about a scar. Depending on how well the wound heal, it will determine how the scarring is. Some scarring can end up really annoying you, and you end up not enjoying the shape and size that made you go for it in the first place. And every time you undress and look at yourself in the mirror, it becomes a mental health battle. The purpose is to feel good, but then it's taken away from it because of the amount of scar you have, and it's hard now for you to undress yourself where relevant. So take that into consideration. So with incision and surgery comes a chance for some nerve damage as a result of cutting into muscles and tissues, and this might cause you to have a minimized sensation, or numbness around that area, so you no longer feel things as you should naturally feel. And that comes with a disadvantage, because it's possible, if the numbness becomes really severe, it's possible that you might hurt yourself and not even realize it, and by the time you realize that you have a bruise there, it has become what we call pressure ulcer, and really it's not something you really want to get into, because the first idea is to look good. That was why you went for it in the first place. So when you end up with a sore that is smelly, stinky, embarrassing, it knocks on your self-confidence, and you realize that that will actually take away a lot from you mentally, as opposed to leaving yourself the way you were before. Of course, infection, yes, we know that infections can be simple, small, or it becomes really septic, and that becomes a life-threatening situation. So, and there's a chance for infection every time you go for surgery. So it's important that you take into account what you're deciding to do to yourself every time you want to alter your body for non-medical reasons. Also, there is a chance for bleeding. Bleeding is one of the common occurrences when you go for any surgery, and the butt enhancement one is not an exception, so take that into account. One can also react to the effects of the anesthetics, the medication that helps you to not feel pain or to sleep while the procedure is going on can end up causing problems for you. It's possible you might have an adverse reaction to it, ranging from severe itching to respiratory distress, and might even lead to death. Now, the other thing I would love to talk to you about is the method in which it is done. I am not a specialist in that area, but I have done my research and I can tell you very well. There are different methods of butt implants. Of course, the most expensive one will be like extracting fat from maybe your belly, your arm where it is saggy, and putting it into your bum to make it look nice and shapy. But it comes with a price, which is money. And the cheapest one is those ones that on TikTok you hear them say, I run am for agege. Please beware. Number one, if you choose somebody who is not qualified, or you know that somebody say then say, and you put your butt there for somebody to cut it, know that you're toying with the most expensive thing, which is your life, which is you. Because if they decide to use the silicone injection or the hydrogel, now sit down very well, let me explain to you. Now, things like hydrogel and silicone injection can even be taken from gel or silicone for the bathroom floor, like you're seeing in this picture here. This one they used to seal tiles on the floor or in the bathroom on the walls. Yes, somebody might inject that into you because they are quack, and you end up carrying it. I tell you, if that gets into your bloodstream, stories that touch the heart will occur. So you now see, it is the cheapest. Like I said, it comes with the most expensive price, which is one's life. So before someone decides to make such decisions just to look good, just to influence, like I said, I won't judge. Honestly, I won't judge. Yeah, do what you want to do with your body. I'll do what I want to do with my body. It's just making an informed choice that is the big thing here. All you need to do, like I said, make sure that you have weighed the benefits, which is the looking good, or the coming to terms with your emotions, or the satisfying the person who thinks they need your butt to be that big, with the fact that you might not even be there, or you might not even be there because you've passed away in the procedure, or you might be there. If you're an Igbo, translate this in the comment section, please. Odendo onwukamma. Translate it in the comment section. So, and like I said, it is cheap, and those are the type that can be run in Agege. A quack person whose purpose is just to get your money, yes, your hard-earned money, will inject these floor tile sealers, silicones and hydrogel into your body. They are dangerous. You can Google and search them yourself, so that you will not say JulieCity brought you this news because she wants to discourage you. Like I said, I'm not discouraging anyone. I just want to make sure that we are all here until our time, our actual natural time comes to go back to join our maker. Not because of ignorance, because like they say, ignorance is no excuse. Now, if you engage a specialized person, not the one that is in the back of the street, a trained doctor in aesthetics and this surgery, certainly one of the things they will go through with you is your medical history. There are certain conditions you will have that this surgery might not be for you. If a person has diabetes or some cardiac issues or blood clotting problems, now the whole thing we talked about, the risk, there's chance that the wound will not heal properly because of course, the impact of diabetes. Nerves problem because of diabetes is harder to recover because of diabetes. I'm only using diabetes as one of them, but you need to engage a qualified person. I can't stress that enough, because they will go through all of this with you. With your medical history, the professional will be able to give you the best advice and help you to make the right choice. And if you decide to go ahead, then you know that you have done all your research and that was the best option for you. The other thing to consider as well is the type of medication you are on or you should take. Now, if your surgery has been built and you are on blood thinners, or even anti-inflammatory, things like ibuprofen, aspirin, you're having an injection that helps your blood not to clot, then if your doctor tells you not to take them, or before you even take any of those medications or anything that you're not sure of, you contact your specialist. They'll be able to let you know those medications that you cannot take a few days before your surgery or a week before your surgery. Why? Because blood thinners and anti-inflammatories have the tendency to make you bleed. Like, they are called blood thinners because they help to thin out the blood to help proper blood flow. And there are certain conditions you will have and you will need to take them. It might actually be compromising you or your life regarding that surgery. So beware. Make sure, again, you employ a specialized doctor, not any kind of doctor, a specialized one that you are sure they are well trained. If you are given an appointment, or the person you have employed does not ask you to come in for a physical examination to check and mark the areas to see if your body will take it, what kind of skin you have, see whether there are previous scars there, and all of that, ask them, am I or am I not coming? And begin to check them again. Are they qualified or are they not qualified? Because a qualified and a specialized person will take you through all of these steps. So it's not just something like, I'm finishing today, I contact somebody, they book me, they just say, come, you can do it. I've done 20,000 and they are all there. Can you not see that person? Just come. And you go without any checks, no medical history, no medication assessment, nothing. You just go the next day, pack yourself and surrender your life to a quack person who will end up toying with the most expensive thing, the most precious thing in life, which is you. The other thing that you also need to take into account is the fact that on the day of surgery, please don't go alone. There was the other story. I don't want to put people's name here. There was a story that went out that I listened to not too long ago regarding the lady who went. Now, she went for this particular surgery, and after she finished, she complained she wasn't feeling well and she felt like she was bleeding. The so-called doctor took her for granted, and what happened? She ended up dying. Now, the saddest part of it was that she died and they actually took her to mortuary without informing anyone. Why? Because she went by herself. And it took many days for her friends to say, Haba, before she left, she told us she was going to so place for surgery. We've not heard anything, we've not seen her. Let's go and find out. It was only when they got there that they were referred to the mortuary to go and find her corpse there because it's been deposited. Oh my God, that actually did break my heart. So please, if you finally, after all your research, decide to go for this surgery, make sure you have somebody accompany you. At least if for nothing, they can be there to hold your hand and support you. And if anything is going wrong and you are not able to speak, they can speak on your behalf. And God forbid anything unforetold happen, at least somebody will have your voice. Yes, it's important that you go accompanied and make sure that people are aware of where you have gone and go accompanied. I hope these few information I've shared is useful, and I hope that if you decide to go for any of this enhancement procedure, that you weigh your benefits and your risk. Yes, it looks beautiful. Yeah, I would love to. But weigh it. Is it really worth it? If it is worth it for you, good job. That's why we have the specialists. But make sure you employ qualified people. Don't go playing with quacks. Don't go playing with procedures because they are cheap and everybody is doing it and you want to belong. Make sure you're doing it because it suits you and suits your specific medical needs. Till I see you next time, don't forget, your health is your wealth. Have you subscribed? If you have not, it's time to do so. Go on, click on that red subscribe. It's no longer red though. Click on the subscribe button. I think it's black now. Yes, and the notification bell. That's where you get notifications for all of my uploads and you won't miss a thing. Go on, leave a comment. I want to hear from you. Do you know somebody who has done it? What do you think about breast surgery? Is this something you consider? How do you feel about it? Let me hear from you in the comment section. And if I've missed out anything, I would also love for you to add. If you're experienced in this area and you're a specialized person in this area, please educate us in the comment section. Now, those videos popping up, consider clicking and watching them. Until I see you next time. Yes, bye-bye. But not take your life play. Your life matter. Your life matter, and you important to God. No bring you here to come joke. Him bring you here for purpose. May you stay fulfill purpose. No throw your life to somebody where in eye now only to see money, to take your money where you don't work hard for.